Welcome back to part 2 of management of sickle cell crisis. If you haven't watched part 1, you know what? Run to YouTube and TikTok or YouTube to watch the part 1 of management of sickle cell crisis. You're welcome back to my beautiful program called Health Talk Queen 1. Don't forget to subscribe to my YouTube channel, and for those who have already subscribed to my YouTube channel, I don't know what to tell you guys, but just to say thank you so much. You are the queen followers. Thank you. I appreciate you guys so much, and I hope you guys are learning. You are acting on all this health tips that I'm bringing out, and I appreciate you guys 1,000 times, and I'm giving you guys 1,000 heart. Okay, so let's dive into part 2 of management of sickle cell crisis. In the previous part, the one that I just downloaded, I was talking about dress warm. If it's cold out there and you have sickle cell children, or as a parent that you are sickle cell carrier or sickle cell patient, please dress warm when it's really cold, because remember we said cold can trigger it, and if it's warm, dress light, so that way your body system can be regulated, the temperature can be regulated. So always dress appropriately to the weather condition. Okay, please dress warm, especially when it's really cold out there. If you live in environment that is cold, like in diaspora, please dress warm appropriately. Exercise as tolerated. Remember we said one of the trigger is rigorous activities, so you don't want to go into intense exercise, but rather as tolerated. Do it as per your doctor's recommendation, and also as per the way your health can carry it, especially when you're a sickle cell carrier or sickle cell patient. You want to do exercise as per your health can tolerate. But in a nutshell, exercise is still good because it helps those stiff muscles to dilate and increase in in activity. So you want to do it as tolerated. The next one is avoid being around sick people. This is very important. If you're a sickle cell patient, you want to avoid as much as possible to be around people who smoke and also people who are sick. Preferable if you're in a flu season or cold weather, you want to use your mask. You want to use your mask just to prevent yourself, because this time around your own prevention, your health prevention matters a lot. And some people, even though they are around people, they won't tell you if they are sick or not. So just to be on the safe side, if you're a sickle cell patient, just put on your mask. Put on your mask, protect yourself. And another one, wash your hand frequently. If you are going to school, wash your hand. Put a baby hand sanitizer in your backpack so you can use it frequently. Hand washing is #1 prevention of sickness, or #1 management of any infection disease process. So you want to make sure your backpack has hand sanitizer, or you frequently wash your hand. Very important. And then we'll go back to hospitalization. As a parent, let's say you've tried everything. You've tried all this. We are talking about the management of sickle cell crisis that I've talked about. You tried everything, but the pain keep excruciating. You know your children. You know when your child pain treasure is high, that it can't be controlled. Please take him or her to the nearest emergency room, or you call the provider and tell them that, okay, this is what I've been happening. I've been trying to do A, Y, D, A, B, C, but it's not working. What is my next plan of action? So that way they can take the patient to the hospital and then get hospitalized, and then take it further, medically. Your doctor, your child doctor, is your #1 friend, is your #1 helper. apart from, praying and all those stuff and the intervention, other intervention, you still have to take the child to the hospital when the pain is uncontrolled. So that way they can take it further, because in the hospital they can do rigorous treatment. If they have to put the patient on a stronger pain medication or PCA pump, or they have to do like narcotic, just to control the patient pain, they will do it. And sometimes some patients, sickle cell patients, they end up getting blood transfusion because their H&H, their hemoglobin and hematocrit can be low. So they usually give them blood transfusion too. And if they have to put them on antibiotic, we have steps in the hospital when we have patients with sickle cell that we go by, especially when they have fever. There are some things that the doctor will order and they will do it step by step. So this can only be managed in the hospital if they get hospitalized. But we are talking about home, how you can manage it home before he gets to that stage. Okay, so I hope all this help. Very important. It all involves about making sure when the symptoms come, treat the symptom, do pain management, which is number one. Okay, and then and also I always tell patients with sickle cell crisis, you can do other distraction in the sense that if you love to listen to music, play music. It's not that you will still treat the pain with pain medication, but sometimes music or whatever you love, if you love to watch movie, you love to do yoga exercise, whatever your body or your mental brain love, do it, because it distracts you away from the pain. There are some patients that love to watch movie. There are some patients that love to do yoga, breathing exercise. Whatever you like, do it at that time when the pain is really excruciating. Use your pain medication. Do all this management that I mentioned. It will distract you away from it. At least it will relax your brain, from me. So it's very important. Look for it. And if you have to go to therapies too, therapies as per your doctor recommendation, go for it. But the most important thing is hand washing, pain management, and also use your medication as per your doctor's order. Use your multivitamins if you have to, use your multivitamins, and make sure it is prescribed by the doctor. Especially with sickle cell patients, make sure it's prescribed by the doctor, and the dosage, make sure everything you use it on time. Once you notice that the child is having this pain, is cranky, the mood is changing, go for it. Start treating, so that way you can manage it. It will not escalate to the extent that you'll be taking the child to the hospital. Okay? And the key thing, like I already said in my part 1, there is a chart that I will download for you to know your blood group. It's very important. It's not only to prevent situation like this, is also for you to know, should in case of emergency and they ask you what is your blood group, you don't know it. It's very important that we know our blood group. Let's know our children, so we can know it and put it in a safe little diary, so that way we can keep track that, okay, this is what my children blood group is, just in case in the nearest future they want to get married, so they can know to marry the right partner with the right blood group. It's very important. So with every disease process that I'm bringing to my channel, I will be bringing supporting write-up. So watch out for that chart. I already have the chart on my TikTok, Health Talk Queen. So, but I will repost it again at the top, and hopefully I'll be able to put the same chart on YouTube, so that way you can go back to it as reference. Also, the management of sickle cell crisis, I will be putting it. Till I see you guys in my next video, please subscribe to my YouTube channel, Health Talk Queen 1. Health Talk Queen 1. I hope this helps and we can kick sickle cell management and manage it effectively. Bye. Take care and God bless.